Checking OCD, what it is, symptoms, and treatment. Hi, I'm Michelle Risser, and I'm a licensed therapist specializing in perinatal mental health, including OCD. Let's go over checking OCD. In this video, we'll go over the definition of checking OCD, examples of checking OCD, types of checking OCD symptoms, and how to get help for checking OCD. What is checking OCD? OCD involves the presence of obsessions, which are recurrent and persistent thoughts, urges, or images, and compulsions. OCD checking is observed in checking compulsions and rituals. Rituals and compulsions are meant to reduce anxiety, but they really only reinforce it. It's common for people with checking OCD to start to distrust their memory as a result of the experience. Examples of checking OCD include leaving work to go home and check if the lights and appliances are off, rushing away from dinner with friends to make sure that their car and house doors are locked, constantly fearing that they haven't done something and bringing it up repeatedly to get reassurance, OCD checking and rechecking personal items to ensure that they have them even if they haven't moved, or taking significantly longer to complete tasks, especially if they involve fears of harming others or themselves. OCD checking can be complex, and there are many different things people with OCD might check, including checking locks, checking the stove, light switches, faucets, etc. to make sure that they're turned off. Checking related to harming self or others, making sure that you're not acting on any impulsive or aggressive thoughts. Checking for mistake, or checking relating to your body or health. People with checking OCD may struggle with intrusive thoughts regarding fears and safety. Checking OCD obsessions can include a fear of something bad happening to yourself or someone else, intrusive thoughts of not doing something that could lead to or prevent harm, like turning off the stove or locking the door, fear that you've lost a meaningful item, fear that you'll make a mistake or say something hurtful, or fear that you may contract a serious illness. Checking OCD compulsions can include repeatedly, sometimes ritualistically, checking that the appliances are off, repeatedly checking that the doors or windows are locked, inspecting things closely, sometimes even taking photos, seeking reassurance, or mentally engaging in rituals to review what you did or didn't do, avoiding certain tasks, behaviors, interactions, etc. to attempt to avoid anxiety and checking, or repeating certain phrases or words. How to get help for OCD checking. OCD checking can impact people's lives significantly to the point of isolation and even suicidal thoughts. If you or a loved one are experiencing suicidal thoughts, please seek professional help immediately. In general, it can be helpful to reach out early to challenge and work on whatever's happening to you. It may be difficult or stressful to find a therapist. Therapy can occur with a counselor, social worker, psychologist, or psychiatrist. If you're ready to find a therapist, a simple way to start is by using an online therapist directory, which can help you filter by specialty and insurance coverage. How to stop OCD checking. There are things you can do to cope with and treat OCD checking, including working with a therapist and/or psychiatrist, recalling positive outcomes that happened when you weren't checking, exposing yourself to what makes you check while refraining from checking, rewarding yourself for refraining from doing the compulsion, acknowledging that feelings are not fact, and creating ways to redirect yourself from an intrusive thought. Final thought. Although it may not be easy to acknowledge, symptoms of checking OCD can affect you or a loved one in several ways. Recognizing these symptoms and experiences is important to exploring what's happening and starting to seek treatment.